Travis.
What's going on?
I'm tired.
I haven't slept yet. I slept
That-
about 2 hours. Felix said 1:59, 12:59 this morning.
Oh, terrible.
Sort of red eye.
Oh. We're good to go. We're still.
Okay,
recording.
sorry for the relay, everyone. I was in the process of asking Michael Stiley about call types that 911 receives and whether or not he thought some call types might be better answered or equally as well answered by an unarmed division of the city with different training, obviously, than the police department. And I would also add that we have Heather Dunbar here from the Advocacy Center, and we want to hear her. Campbell, what did I say? Dunbar?
Something else other than Campbell.
Sorry,
No problem.
it's Scottish people.
I was wondering when it changed.
Maybe I was on the red eye. Sorry. Who has a lot of experience in answering crisis calls, and we want to hear her opinion as well. So Michael, let's.
Sure. So what I'd like to do is maybe just share some thoughts that I've had since being part of the process. So as you may or may not know, I started with Tompkins County just about a month or two before I attended their first meeting. And something that struck me right away is that when we were started looking at the call types, we're looking at pretty much all the call types, as opposed to maybe looking at the call types that we routinely actually dispatch folks to. So I remember in one of the meetings, we started to talk about abandoned 911 calls and whether or not that should warrant an officer's response or if that should be an alternative response. And what I did, and I wish I had that data in front of me, I don't, but I went back and I ran the data at the time, and I was shocked, frankly, at the number of abandoned 911 calls that we actually get, not just in the city, but across the county, and how there's a process internally for handling that typically does not warrant a law enforcement response. The reason I'm sharing that with you is because in that earlier meeting, I think there was a perception that law enforcement responds to all abandoned 911 calls. So I bring that up because it was in the thousands, it wasn't even in the hundreds.
Mm-hmm.
And so I think that perhaps if we maybe take a look at the actual calls and who's handling the calls now and how the volume of calls that we actually get, and then separate them and, to whether or not they're urgent or emergent, because typically that would be somebody within the public safety realm, whether it's police, fire, and EMS, maybe that's a place to really begin. Because then we can really sort of pull out the call types that maybe live in our directory of call types that maybe don't even historically get used for any number of reasons. And I remember at the time thinking that there were call types that we don't historically even dispatch any emergency responders to, simply because they probably do fall into another category that, and another agency might respond or maybe take lead on it that isn't necessarily police, fire, or EMS. So that might be something worth looking at, because then if you do that, you'll really be able to drill down on what calls are typically being dispatched to law enforcement and whether or not they're paired with another emergency service such as fire and EMS. If you can break apart calls that are not urgent or emergent, that might be a good starting point when you start thinking about alternative response. I think the dilemma that a 911 dispatcher might be in is if they sense any level of urgency, they're going to want to send an emergency responder, typically because again, they're going to be probably filtering is it urgent or emergent. And if it falls into one of those two categories, they might just by default feel more comfortable sending law enforcement. So for example, if it's an emergency medical services call, and there's any sense that the scene could be unsafe, they're probably going to yield to law enforcement's instructions as to whether or not they need to respond to that call based on the information that we gleaned from the caller. And that's just one example. But I think that might be something worth doing, going back, and that's data that we can help you with. We can go back and we can pull the reports, we can compare it. You can maybe pick the call types, or we can just look at the call types and see how many actual responses were paired with a particular call type. And then at least you'll know what call types are in play. and which ones you can maybe completely remove.
So, yeah.
Go ahead. Thank you, Michael. I feel like we jumped right in, and of course, I was not part of the working group, so I know that this is a continuation of a private offline conversation. And I apologize if I'm going to ask some questions that you've already gone through,
Sure.
Through the working group process. When calls are issued, how often do you have a debriefing with the responder to discover what the calls actually ended up turning out to be?
Not very often. In fact, that is unfortunately a consequence of working in the 911 center. Like a 911 dispatcher typically never really knows what the outcome is. They'll know that the call was eventually cleared and they might have some disposition, but if it's like a law enforcement call, for example, those dispositions are typically coded in their report, and we know that they're clear, but we don't necessarily know what the outcome was, which can sometimes be a challenge for a 911 dispatcher. So because that's like going from every call and having no sense of closure. And it's just, again, it's just sort of a consequence of our line of work where we don't typically know.
Right, so, and I appreciate that you're receiving calls as they come in, you dispatch respondents, but in terms of truly understanding, like, if there might be any adjustments made in terms of, is the response the proper response?
Oh, I
Did it merit the level of urgency or emergent, aspects? Without that closure of the conversation, it's hard to know, as we're asking you for advice, because
Absolutely.
you don't get to see on the backside how that turns out. And so that's one element I do think needs to be part of the conversation as we think about changing a process. We don't even know really where the successes or challenges might be in the process itself. You also talked about the algorithm of questions that come forward when you have a medical crisis. Do you have other algorithms having to do with, from an unprofessional standard, like what I would think, algorithms for a mental health call, algorithms for perhaps a call having to do with someone either in an addiction crisis, algorithms having to do with a domestic crisis, which, at least in my experience, looking at the calls that I see in my community, the most frequent call is, for example, for a noise violation, but often that noise complaint turns into something else entirely.
Sure.
Right? It's a noise complaint. All the caller knows is that there's something very loud. It's kind of alarming. They make a call, depending on where you are, you're going to jump to certain assumptions, but that call is, if it's going to be a party or a domestic or somebody, it's like, it could be a whole bunch of different things.
Sure.
And so you never quite know. And so could you talk about the different call algorithms that you go through in order to make sure that you're eliciting or delivering the right type of response?
Sure. So often what happens is when people call 911, they typically know what services they're asking for. So they'll simply ask for that service. So if it's a request for a law enforcement officer to respond, typically that's what we'll do. The two examples that you gave, with I think it was an overdose, and then what was the first one?
Mental
health, yes,
or an addiction.
Right, or
crisis.
you're right. So both of those would actually eventually go through the EMD, emergency medical dispatch algorithm, because those are calls that are associated with a medical emergency. So a call for a mental health crisis call is handled through the EMD system. And that's one of the reasons that we try to quickly try to determine what's the nature of the emergency so that we know what procedures to follow. And they're not necessarily as cut and dry. Where it can become a little bit more complicated is the noise complaint with an unknown origin, and why, is it a noise complaint because it sounds like there's a fight, or is it a noise complaint because there's loud music? The domestic violence situation is also one that will often will if we have a report of a domestic event or domestic violence where we'll quickly try to determine that, start law enforcement to the scene, but then also try to determine if there's an injury. If there's an injury, then we start to go through the emergency medical dispatch protocols, because we want to make sure that we're giving instructions on how to render aid to the victim if they've been injured. So in all three of those examples, those would be situations where we would put it through emergency medical dispatch, or the emergency medical dispatch algorithm, because it's associated with the medical emergency. But all three of those events, the way it is now, would also likely warrant a law enforcement response as well. And part of that is because in some of those examples, EMS has asked that law enforcement respond in conjunction with them to ensure that the scene is safe, so that they can go into the scene and render aid. So that's something that EMS has requested for the three types of calls that you gave examples for.
Thank you, George. Sorry. Thanks, Michael. I have a couple of quick questions. I have a couple of questions that will be quick for me to ask. First, I was wondering if you could talk a little bit about how much discretion exists in the dispatching of emergency services or emergent services, urgent services. I've heard reports from some localities that have adopted alternative and co-response models that, sort of despite their efforts at organizational restructuring, at the point of dispatch, calls are still being escalated when there was ambiguity about what the call type might be delineated as, because at the dispatch level, folks were concerned about sort of getting the call type wrong and not
Is a
sending.
concern,
Yeah, so that's my first question.
No, and it's a great question, and there is that concern, because what you don't want to, typically a 911 dispatcher is, in our case, is servicing the entire county. So it can be somewhat unique across the various jurisdictions. We've tried our best in Tompkins County to refine it so that we have the same protocols across the county, because typically, and I'd like to invite any one of you that would like to come up and sit in dispatch to see it, because I think that will provide a great deal of context. And then you could see how a 911 dispatcher actually takes the call in and the process, and that's an open invitation. Absolutely, and I think it would be great if you could do that. Because again, I think that when you do that, it would just be very eye-opening. I think you could see how sometimes the way the call starts to evolve, that there often will try to err on the side of caution, especially if it involves an EMS response, to ensure that they have some form of support. And it doesn't necessarily just mean scene support. It could also mean that there's another agency that might need to respond in advance of them if it's a certain type of medical call, because if they can get there a little bit faster, like a cardiac event, Ithaca is an example of that, where the fire department will also respond. So there is a concern of not getting the call type correct. There is a certain amount of anxiety that I think the 911 operators have because of that. So they'll often err on the side of in their caution if they're not sure, because they just don't want to get it wrong.
But that's super helpful. Thank you.
Yeah.
And just in caution in this instance being the more comprehensive response, right? So like,
Right.
yeah.
Especially for the urgent and emergent.
Yeah, right.
And that's why I kind of broke that down in the beginning,
For
because
sure.
if it's not urgent or emergent, then it really falls into, I think, more of like a service call.
Right.
And then if you were talking about service calls, then I think there's a lot of opportunity there, but then those would not typically involve necessarily a public safety response. And I often said, I think Travis has heard me say this in the legislative meetings, when I think of public safety, I don't just limit it to like law enforcement. It's in my world, it's police, fire, EMS, and 911, all sort of like working together. So where one doesn't necessarily respond, maybe another one responds. And sometimes they all have to respond together too.
I'll hold my other questions for SCP.
Phoebe?
Okay, I'm unmuted. Well, thank you. I have a few questions, not long ones. I'd like to, it's pretty sure is your feelings about RPS. One, what do you feel about the need for RPS in this community? What is another one is, do you think having underarmed responders to help with calls is a need and could be helpful? And also, what is the time span for training people who will be answering the calls?
Can we just maybe start and work our way back? Can you just elaborate, so I'm clear on your question with regards to the training for the folks answering calls? Are we talking about an unarmed responder? Or are we talking about the 911 center staff?
911 center staff.
I think
What is,
I'm sorry.
good,
Well, I think it all really depends on what the outcomes are. And I think
Okay.
that, you know, as far as reimagining, I think that if that's what the community feels like they need, then my job as a department head for Department of Emergency Response is to figure out how I can assist you in getting there. You're the authority having jurisdiction, which means, you know, you're really the decision makers, and we do our best to work with the decision makers on what works best for their community. So what you're struggling with, I think a lot of communities across the country are struggling with, but for various reasons. And you asked me what my thoughts are. I think from a personal level, I think because we're talking about I think we're talking about alternative response as opposed to unarmed response. And George, you might remember me saying this in a couple of the reimagining conversations. You know, I look at what the sheriff's department did, for example. Those are alternative responses, right? It's not necessarily about armed or unarmed, but let's suppose that you got to the point where you felt that another emergency service should maybe answer a call that's typically being done now by your law enforcement community. I think that you'd want to loop that particular discipline in, whether it's say it's fire and EMS, to see whether or not that's a void they could fulfill and whether or not it really fits within their responsibility as an emergency responder. So I'd like to see that broader conversation where you're looking and working with those other public safety entities to see, does it work for them as well? You know, because when you get into like EMS, for example, EMS will often say that they want a law enforcement response because they want to make sure that the scene is safe. So learn from EMS, well, what calls do you typically, what calls or call types concern you that we need to start thinking about then if you'd like to have law enforcement there, you know, so that you understand that, so that you're making sure that that piece is addressed. Because you could say, well, we don't want necessarily law enforcement to respond to this, but then who would respond? You know, because if EMS responded, as an example, that is a form of unarmed response. It's just EMS, or the fire department responded, or maybe code enforcement. I don't mean to keep you out of the conversation. I'm not turning my head, but you know, there might be, for example, call types that could maybe even go to a non-public safety entity as well. And we talked a little bit about that but I think the only way we're really going to know is to really look at the call types and see who's answering them and what the volume is, and whether or not those are call types that you might be addressing, call types that don't even have any, that don't even typically get used as a response.
And you can help with that.
We can help with that. Absolutely. Absolutely.
Heather, I want to bring you into,
Travis, do you have a hand there?
Yeah,
Someone jump in.
and then I want to, this will feed right into you. So this was one of my biggest problems with the reimagining process that I was involved in. We spent 3 months talking about call types. At the end of the day, Mike, and help me out. If the center gets a call, there's a person that says, hey, outside down the street, there's 4 big black guys, and it's 10 o'clock at night and they're arguing. It looks like they might be fighting. What happens at the call center, and then I'll go from there.
Sure. I mean, that type of request would probably warrant a law enforcement response because there's nobody else in queue to handle that. So when we think about the other services that we dispatch, fire or EMS, that's not a call that you would typically dispatch one of those other 2 entities to.
Right.
Yeah.
So here comes the police. They got the call from 911 that there are 4 or 5. There's a large gathering of black men, because that's what they use. They say black men over at Conway Park, and it looks like they're arguing, could be fighting. So now 3 or 4 officers show up, and their adrenaline is pumping because there's a fight, and there's a lot of black guys outside fighting. So when they show up, and it's 4 black guys having a good time, laughing and joking, no arguing, everything is cool, and these officers show up, hands on their guns, wanting to know what we're doing, and ready to go. We're like, what the hell's going on? What is this all about, right? Those are the call types that, like, we're talking about call types Those are the ones that put my life in danger, right? All these co-responses and all these other things, those need to happen for a variety of reasons. But those call types put my life in danger. They put my son's life in danger. And we've had countless incidents in this community of that. I've had over a dozen sitting in my backyard, hanging out, chilling with friends, where I've had police show up. The problem becomes the policy and training of our officers and the way our officers approach us, right? It has nothing to do with the call center. It has to do with policing as a whole and how they treat us, how they view us, and how they see us. We could talk about calls all night long, but it's the response once the folks get there. That's what it really comes down to. To me, that's what reimagining is all about. In domestic situations, and I'll turn it over to Heather, it's even more scary, right? Because I could be having an argument, arguments happen. Somebody calls, officer shows up, they see a 275-pound black man standing there, things hit the fan pretty fast, right? So it's not the call, it's not the type, it's not the response, it's the response from the officers once they get there. And we keep talking about call types. We're not talking about the root of the issue, and that's officers' behaviors. Go ahead, Heather.
Thanks for that, Travis. So I'm Heather Campbell, the Executive Director of the Advocacy Center, and just for context, we are the domestic violence, sexual violence, child sexual abuse services program serving the county. So providing crisis services, providing advocacy. We're working with many survivors who are involved with the criminal justice system, either by their choice sometimes or not by their choice. Or we're also working with survivors who have chosen not to interact with the criminal justice system. And we're 24 hours a day. So we have a 24-hour hotline, we're responding 24 hours a day, and we're working with people where there is a really acute crisis, there's an emergency, there's abuse happening right now. We work with people where abuse is happening, who are coming to us not in crisis, and we're working with people who the abuse may have happened a long time ago. So it's really the full spectrum. You know, a little bit about my experience. I started my work in this community 25 years ago as a domestic violence advocate. And I spent a bunch of those years working as a legal advocate. So working with survivors who were involved in the criminal and family court system, and also working really closely with what was then the community police officers, and doing follow-up in survivors' homes after crises. So, and George and I, when we spoke, talked a little bit about that experience. So I think we also have some previous models in our community of the ways community policing have worked in different ways in the past here, and in ways that, you know, we've moved past. There are pros and cons. There were pros and cons to that model as well, but we've really moved past and I think lost some of that as well, and lost some of that strength. You know, I want to say we really support the Reimagining public safety process. I think gosh, there's so many things I could talk about right now. There's so many things I want to say to you all. I think that I want to break down the populations that we work with, because I think things look a little bit different. And I want to talk about domestic violence, because I think that's the population that comes up most when we talk about reimagining public safety, when we talk about calls. You know, I agree. I think, Travis, what you're saying is I don't think we're ever going to be able to differentiate on the 911 level whether something's a dangerous domestic or not. DV calls come in all kinds of ways. They come in as a discon, disorderly conduct. They come in as a noise complaint. They come in as a kid calling.
Thank you, God.
And so I don't think we're going to be able to, I think 911 operators are never going to be able to make that call there. I agree. I think it's very much in the response. And as a domestic violence advocate, when I talk about the tools that we've developed in the last 25, 30 years in our communities, in the movement, it's like we have a box, but it's full of hammers. And the only tool we have developed for accountability and safety is the criminal justice system. And I want to be clear, I have worked with survivors where I believe the criminal justice system intervention saved their lives, that there was no other options for them in order to be safe, because that person was relentlessly focused on harming or potentially killing them. And we did not have anything else. I have also worked with survivors in this community who I believe have been harmed by their interfacing with the criminal justice system, no question. And I've also worked with many survivors who have chosen, and most of those survivors were BIPOC survivors, who've said, I am not going to participate in this system. I'm not going to reach out to this system for support unless it is absolutely my last option, because I know the harm that it can cause. And we still have a box of hammers. right? And so, we've been talking a lot in our movement for a long time about expanding and also listening to the voices of BIPOC and queer survivors who are the communities most impacted negatively by, and so, and even when the system is working as designed, even when the criminal justice system is working as designed, sometimes outcomes are still not good for survivors. And that is not, it's not the fault of individual actors. There are often times that everyone has done the quote unquote right thing, but it still does not sometimes we don't sometimes get the outcome of safety and healing for survivors and accountability in a healthy way for people who are harming. And so I very much am interested in talking about alternative responses to domestic violence. I also want to acknowledge this is a way bigger community conversation, because just deciding to send someone unarmed is not an alternative response to domestic violence, because there's a whole lot of and then what? And then what? And when this conversation first started happening in our community in a very meaningful way, in the depths of the pandemic, I started reaching out to state and national leaders who are thinking about this, because I thought, we really have an opportunity here, potentially. We have an opportunity to potentially, as a community, focus on this and focus survivor experiences, survivors who have not felt and not been well served by the systems we have now, and do something different. The answer on that is it's complicated. But I do think we have a real opportunity here. There are some small models that exist, but as far as I can tell from talking to state and national people, no one has scaled up any of these models to a community level. These are neighborhood responses, very specific community-based responses. They're very culturally culturally specific. They're very specific to a people in a place and the relationships they have. I don't think that's a reason not to have this conversation in our community, because I think that we know that survivors are not being well served by this system in many ways, and that the most vulnerable, most marginalized people, women, men, trans people who are being most impacted by violence, are often the people who feel least able to reach out to law enforcement. So I would love to come alongside this work in the community and be able to support that larger conversation happening, because just deciding to change the response to the immediate response, sending unarmed versus armed, I think it's going to be very hard in the moment to make that either or decision. And I think on the point of safety, we're going to end up with armed. At least that, because I think and I think that there's stuff we can do to shift that response as well. Absolutely. I also think that will still leave us in the place of that system still not serving all survivors who need that help. So I think that that's a much bigger conversation. It's a conversation that needs resources and time, and it also needs to be grounded in the community. It needs to be grounded in the experience of survivors and have the experience of survivors who either feel like they have been served by criminal justice interventions, or people who feel like they have not been served by those interventions. We have to really ground that. And I would love to be more of a part of that conversation and to help bring that conversation forward in our community. One of the things we also want to think about, when I've had people talking to me about the possibility of an unarmed response for victims of sexual violence, where there may not be an immediate crisis in that moment. So let's say somebody's reporting an assault, which is sexual assault, often there's a delay in reporting. Statistically, it's very common, both for domestic and sexual violence, that there's a delay in reporting, because people don't always report right after the abuse. They may be traumatized. They may not know that they can call. They may wait till they're in a place of safety to make that call. And so it can seem, I've talked to people who've said, well, it seems like it makes sense then. We can send an unarmed responder to have that conversation. The challenge of that then, though, is that if then that survivor, if something is going to move forward in the criminal realm, they have to tell that whole story all over again.
Right.
Oh,
And the impact that can have on survivors can be intense. And so I think there are things we can do to shape that experience. And again, we have a multidisciplinary team here that works on sex abuse cases from report through disposition. And so there are systems already in place here, and I think there's more that always can be done. But I worry, I think that's one of those things that sounds common sense and sounds like, well, that would be a good thing, but actually can have unintended consequences for survivors. who then may have to relive that experience multiple times. And that's definitely from the research and our experience with survivors, that's definitely not best practice. We want survivors to have to tell their stories as few times as possible to as few people as possible. And that's going to be and that's what's going to support a potential prosecution, but also support survivor healing and safety as well. Lastly, child abuse cases. And again, I think there's definitely room here for some alternate responses. And this is where some of those, how we approach cases, a kid in their yard, right? A kid left alone. There are ways I think that we can engage with those cases differently, potentially in some cases than we are now. I would encourage bringing DSS and CPS to the table on this conversation if that's being considered, because CPS is already responding with law enforcement.
CPS is.
I'm sorry, Child Protective Services. Thank you. We fall into acronym soup. Child Protective Services, is already responding jointly to child abuse cases. And so that is already happening. And so I think involving them in the conversation would be important if you're considering child abuse cases in some kind of differentiated response. And again, just bringing their experience to the table and also better understanding what is already happening now, because there are definitely many cases where both law enforcement and CPS may be responding.
Yeah, I just springboard off that one. So I think that's a really good point. And that was a particular call type that we did talk about during one of the reimagining meetings, where it was only, I think, I don't want to misspeak, but it was below 20 in a year for the entire county. And I
What was below 20?
child abuse, where we would get a phone call and where somebody was reporting a child abuse case. And I think that that's typically because in some of your other examples, when we get the call for help,
AJ,
it could be a situation where somebody is reporting somebody that's screaming, maybe somebody is being abused, or we don't necessarily know that it's a child abuse case. So that's a good example, I think, of a nature or a call type where we don't use it very often. It's minimal. And I think it's because of how the call comes into us, and we don't necessarily know that it involves a child. And at the time, if I remember correctly, when we started looking at that particular call type, I think the calls that we did get were probably the mandatory reporting situations where maybe somebody from the hospital or school, and then they were very clear on the reason why they were calling. And then that's how we coded it in the system, but it wasn't in the hundreds. That's what I mean. And so that's a good example where, of course, we want the right resources going to that type of call, but just because we don't use it that often, it's an example of a call type where we should look at it, and we should look to see it actually how many times we're using it, because that might then provide some guidance on alternative response.
I have a comment, and this will lead into a question for you. I've actually had our acting chief point out the same thing you did about victims of domestic violence having to tell their story more than once, and how damaging that can be, and frustrating, and ultimately maybe they'll just stop telling their story. So that's a really important point. Another thing we've been thinking about is the need for a follow-up. And Travis pointed out that we used to do that when we had more fleshed out community policing response and both Saul's program, and now they're doing it in Rochester, and that's something that is intriguing to us, because the IPD says they may answer a call, make an arrest or not make an arrest, but they don't go back and 2 days later and say, well, how are things now? So is that something that you think could be useful for? I mean, you do that.
We do, yeah. And so I think that, and we used to do that, as I said, when I was a legal advocate, I would go out. There were 3 different officers that, we would go out. I would sit at people's kitchen tables with them and, talk about, what had happened. People often have questions about what happened. Things happen very fast in a crisis response law enforcement call. Often things happen very fast. Often survivors are very confused about what happened. They're not even sure if an arrest was made or not, or if not, why, or what happens next. So there's very logistical questions that people have. But then there is that sort of what next piece, and recognizing that the law enforcement, whatever was the underlying issue, if there was an underlying issue that warranted law enforcement, it was likely not solved by that law enforcement response, right? So I think there can be, it's interesting, I've been trying to reach, you were talking about the Rochester program, I had reached out to them as well, and I reached out to the domestic violence program in Rochester to talk to them about it. I'm not sure they're doing follow-up in DV cases. I'd be interested, and I'm trying to reach out to them now, and we've just been playing, voicemail.
Yes, have we?
But yeah, I'm not sure that they're doing response to domestic violence cases outside of where there's also an underlying mental health call. Now there may be some overlap in those calls, but there are many more cases that are domestic violence and not mental health as an underlying issue. But I think that can be good. I think that more formal connection between law enforcement and how do we make that link when there's a call to other services that are needed, and how do we do that more directly? And that's been, we've been working on different models for that, for 25, 30 years. And, models come, models go. They're resource intensive as well. Even just I'm on the Reimagining committee for the county, on the data committee. And even just talking about how we can't track things from 911 to law enforcement to the DA's office to disposition. It's a lot of that is manual. Pulling DV cases out of the data is mostly manual because there's no domestic violence charge in New York State. It's an assault, it's harassment. There are these charges based on behaviors, not based on relationship. So all of that is manual. So I think there is a real resource question here that comes in about making a decision about where are we putting those resources. But I think follow-up is good. But then I think if we're looking at follow-up, I think we have services for follow-up models for victim services. That's the role we're fitting. If we're talking about alternative models, there's this other piece about how do we follow up with the person who has been harming? And are there models for accountability that don't involve law enforcement, that don't involve arrest? And that's what some of these other models are looking at communities. How do we look at what does community-based accountability look like? And again, I think that looks different based on the community. But I think how do we add more tools? Because I think more survivors would be willing to come forward to talk if we could offer them more options.
Right.
Yeah, I agree. And I think a dilemma that we're sometimes in the 911 center is that, we're trained now to quickly triage a call and get it out. I'm sorry.
No.
And so to that point, there are times when a dispatcher will spend as much time as they possibly can to really try to work with the caller. You'd be surprised at some of the calls that we get. We have folks that call the 911 center 300 or 400 times a year. And we get absolutely, and the dispatcher does the best job that they can to try to really get them the resources they need. They don't necessarily just send it out to law enforcement. They really try to drill down on the problem. But because our training is counterintuitive to that, with spending time and nurturing and trying to really work through the problem with the caller, I think that's got to be part of the conversation as well. Is there a way for resources to be added maybe to the 911 center where maybe the caller, it can be transferred to somebody with a skill set that can really spend some time working through what their actual needs are, as opposed to quickly trying to discern within 70 seconds, who do we send? And I think that's a little bit of a trap in the 911 system that I think we could do a much better job at. And if I could just say one other thing, because I think it speaks directly to what you're saying about the data and the reimagining piece, I couldn't agree with her more, because we collect data in one of two ways when it comes to public safety in the county. We use a system called Spillman, and there's a computer-aided dispatch. You've heard this system, right? So Spillman. So there's two sides of Spillman. The CAD side, which was used in the 911 center, where we might code a call as a noise complaint. And now a responder gets there and they determine that a police officer gets there and says, no, this was actually indeed a child abuse case. So we might have only dispatched, say, 15 child abuse cases across the county for an entire year. But if you were to run the data on what they refer to as the disposition code, what did that first responder actually see and determine that call was? There could have been 300. And sometimes it's just the way the information is provided to the 911 call taker. So, you know, I would suggest that when you're looking at your data, that you spend some time looking at the disposition codes and then compare that to how we dispatch it. And I think that's more an opportunity for us as well. Because to your point, I think it's a great point that those after actions, you know, and what can we do better? And, you know, that would be helpful. But the irony is that I use this term own, we own, meaning the 911 center owns the dispatch data, and each law enforcement entity owns their own data. So for that to happen, every single law enforcement agency would have to say, hey, we want to do this comparison to see the type of call that we were dispatched to versus what we actually coded the call after we got there and cleared the call. So not trying to put it to that, and I think that speaks, that's why I wanted to. And you're experiencing that now when you're looking at the data, because our data and their data often won't match.
So I want to, something on Heather's last point, led me to want to return to what Travis said about the noise complaint scenario. Because I think you raised a really important point about this debate being in aggregate hyper-focused on the delineation. And when you talk about, you know, community response, right, at the same time, like one of the frustrating things for me is we have underdeveloped the role for appropriate intervention sort of like at the community level, because hearing this example that you gave, Travis, it's like, what role can we play in sort of culture change around like, why are we, I know there are always cases, right? There are always cases, but why is it that there are such a high volume of there's noise, I should call 911, right? And I feel like part of this driver needs to be like, the public needs to have more education and more tools about what responses. I mean, I hear noise all the time. I live close to a college campus. I've never called the police for noise, right? People do all the time. I've never called the police because, you know, someone's walking late at night, but that happens all the time as well. And the frustrating thing for me, I think to part of the point that you raised, Travis, is like, it doesn't really matter if there is the possibility of an armed response, and I'm not talking about just unarmed and armed as a binary, but like if there's a possibility of an armed response for something that is not actually an emergency, like how do we help address that, right? Like, you mean,
I have a thought, I mean, and this is just a personal opinion of mine, but kind of springboarding off your example. When I think sometimes, you know, first responders, it's similar to the 911 dispatchers, they feel like, am I going to get in trouble if I don't do this? So, you know, when you have, if they don't do what they believe is expected of them, that they're going to get in trouble, that there be. So my question is, if the law enforcement officers were to drive by in that scenario and they say they knew everybody involved, or they drove by and it doesn't look like anything's happening, right? What is the community's response if they don't stop, get out and talk? Versus them driving by and saying, everything looks fine, I'm going to keep going. And do we empower them and do we trust them enough to make that decision? So I think about mental health response, right? And having been a field provider at one time and go into a call because maybe somebody is just not familiar with a particular individual, they think they're in crisis, they call 911 and now the cavalry's coming. I'm the first responder. I get there, I'm like, no, that's just John, everything's fine. But there's this expectation, well, if I don't get out and I don't appear to be doing my job, that same caller now is going to call back to my supervisor and say, hey, they never even did anything. They just drove by, they're being lazy. So I think that, you know, are there circumstances where we can empower the first responders to make some of those decisions and do it in a safe space where they don't have to worry about being criticized, especially if they know the folks involved. I mean, it's just, again, from having been a first responder, I've been in that predicament. And it's not an easy one to be in because I've been in that situation where I drove by and then accused of not doing what I was supposed to be doing. So I'm just wondering how it's viewed here.
Your follow?
Yeah, I guess just the last piece I would just say is, right, like I hear in a lot of what you're saying that there are times where there's like perception that, well, this nuisance issue deserves a public safety response. And I guess I'm not offering a solution yet, but just like problematizing, like, I don't know that like nuisance level issues of like noise or things like that, are the best allocation of these like very scarce resources that we are obviously competing across the emergency spectrum for. And yeah, maybe that's expectation setting on the policymaker side of, you shouldn't have, yeah, there shouldn't be a public perception that if you hear loud noise, that you're going to necessarily get a response to stop it, because we live in a city and there's noise. It's gonna make me very popular saying that, I know, but
Answer to that.
yeah, sorry. Simply,
I saw you turn on your phone.
So I would say this about a noise complaint. A noise complaint could be 1,000 different things. And some of them could be a very dangerous situation. Some of them just aren't. And it's okay for officers to respond. It's not the end of the world. It's the response once they get there. So if me and my guys are hanging out in front of my house and my neighbor calls the police and the officer rolls up, rolls the window as they're approaching, they understand that nobody's arguing, there's people talking and having a good time. They could just ride by and say, hey, fellas, we got a call from somebody in the area, you might want to keep it down a little bit, have a good night, and keep it pushing. Because that's what they would do if it was 5 white guys standing out in front of their house in Cuba Heights, if they came at all, right? So for me, it's okay to show up. That's not the issue. If it's a domestic situation and somebody calls because they hear a lot of noise, it's definitely okay to show up. It's what you do when you get there. So if you have a domestic and you have a co-response, officer shows up, and the situation is safe, and they turn the situation over to a professional who's trained to deal with this, right? It's a lot easier to have follow-up after if you've made point of contact, if it's like a warm handoff. It's very difficult. I can't just knock on my door and say, hey, Travis, the other day, police, they sent me some information, there seemed to be some sort of, I would be offended and tell her to kick rocks. But if she came during that situation and said, hey, on Tuesday afternoon, can I stop by so we could talk a little more? Absolutely, right? It's a warm handoff. It's one of the reasons why LEAD works. There's a warm handoff. There's a response that happens in the moment. There's a warm handoff. And then later on, if I'm part of that program and I do have some mental health issues and I'm bugging, the officer could say, oh, he works with Anna. Let me call Anna. And Anna could come deal with that situation. Or wait a second, this person is drunk, they're part of the program. Let me see if they're on the list to get cabs home from LEAD. Or they're on the list, let me get them home. Because really that's all we need to do is just get you from the county, back to Lansing, back to Newfield, wherever you live, let me just get you home, right? Like, these are the things that when you start to add screwdrivers and wrenches and other tools into this toolbox, you gotta have those different things. All I want to be, I just want to be treated as if I look like you, right? When I get pulled over,
Old and overweight.
I'm getting up there. When I get pulled over, I don't want to wonder if I'm going to see my kids again. When you get pulled over, I'm assuming you're thinking maybe your insurance is going up, your other half is going to get a little upset because you got another ticket, whatever. The idea that this may end very badly for me physically is because I'm Black. That's it. It's for no other reason, but I'm Black. And I'm Black with dreads and tattoos and earrings, and it just makes the scenario even worse for myself in many occasions. I shouldn't have to worry about those things. This isn't about call types. This isn't about co-responses. This is about policy and training and hiring the right people for the job. Like, I've said this 1,000 times. I want our police department to look like our fire department. I want them to come when they're called upon, do an amazing job, and then get out of my life. I don't want to feel patrolled. I don't want to feel harassed. And I definitely don't want to ever think that something bad is gonna happen to me simply because I'm not white. Like that's what this is all about for many of us. And there's a lot of things that we can do to change that narrative, but we actually have to expand the toolbox. We have to find more programs. We have to add co-responsibility. There's so much more we can do. And everything has to be rooted in evidence-based, right? We can't just make up stuff. We can't just keep throwing money at things that we think should work or things that people talk very well about. They have to be able to show over a period of time that when you put resources into this, this is the positive outcome that you have. That has to be evidence-based. We can get there.
Every time I have, Phoebe? I don't see you.
Yeah, yes, my hand has been up, and I'm really,
Sure.
that's okay. I'm really just very thankful that Travis is here tonight, because you keep bringing it back to the reason why reimagining public safety was put in order out, right? You keep bringing it back. And I think what's very clear to me is it's not about, it's important for the community and the police department to heal. But what's more important is learning how we respond, how police officers respond to the calls, and our new unarmed responders has a lot to do with everything that has been talked about tonight. And I think for us, like, it feels a lot like we just dancing around a lot of anything to really talk about the reasoning why reimagining public safety has come to our community. We know it was the Executive Order 203. We know why it came to the community. And Travis has mentioned a few different ways in which being stopped by police if you're driving, being stopped, or, so I think our conversation here for me is saying that we're dancing around what we really need to be talking about, right? And I could be wrong, but I really want to hear our conversation more geared on how this relationship between IPD, community of color, and how we begin to work in a way that the mindset of police officers began to somewhat change, because there's a lot of reaction of the way they've been learned, not just on the police force, but throughout history. So, yeah, thank you, Travis.
Thank you.
Every time I get ready for one of these meetings, I think, oh, Jesus, I don't have enough prepared. I don't know what I'm gonna say. And then every time I get bailed out by some really profound thinking and expression of truth by the people who join me in these meetings. And I want to thank you. What I'm hearing tonight, and correct me if I'm wrong, is that this is not so much about armed and unarmed and who goes to which call type. It's about how the police primarily, but probably EMS as well, but particularly police, how they act when they get there, how they treat people. And so much could be better in our community if people rolled up and got out of the car and said, hey, what's going on? As opposed to, shut up and get back in your house. That's kind of a big part of what we're trying to figure out.
Mhm.
So it's not necessarily unarmed response, it's alternative response. But alternative response should be normal response. I'm old enough to remember out in the sticks of Schuyler County when the deputy sheriff would actually give you a ride home. And that's what you're just talking about. So these are, and Heather, thank you. You're a hugely important part of this. I really appreciate you being here. Because domestic violence is one of the biggest problems we have. And I think IPD is totally aware of that. And I think they want to improve the response to that. That's all I got to say. I just want to thank you for bringing these perspectives, because this focuses our job.
I'm glad to see.
I appreciate this conversation as well, and the input of everyone that we've heard from tonight. You know, for me, I'm always thinking about systems and processes, right? How do we get the evidence? How do we operationalize it? What are our goals? Do we have that feedback loop, whether or not we're talking about dispatch or, you know, domestic violence is a growing issue, is the presumption, but we actually know that the data we have might not actually reflect it, because people own data in different locations and you're either manually collecting it and they're not communicating with each other. So when we're looking for evidence-based solutions, first we need to understand where we are. And if we don't know where we are, then we don't know if we're actually going to succeed. And what we're doing is being successful in changing what it is that we have. And what do we have now versus what we had 15 years ago? My 12, 13 years ago, we had the Sean Greenwood shooting, which put our community completely upside down. And for me, that's what I'm thinking about all the time. But is that now? All of those officers aren't here now. You know, there's a lot of how do we close this loop between where we were 15 years ago and where we are now? Do we have the same problems? Is it different? Is it new? Is there something else going on that we don't even know? Right? And unless we have times when there is that loop where, you know, people roll up on your party and then they come out, you know, 3 officers come out and you're not treated like a human being. Does that information get back to the department so that the department can then close that loop and say, okay, we had a call. Maybe dispatch could have said, do you actually hear people fighting instead, you know, so that when you're sending officers out to a fight, there actually has been a question to confirm there's a fight. So that when the officers respond, you know, they're not jumping to it. You know what I mean? I just feel like we need to close the loop on so many things because we're coming in and we might have resources available that we're not utilizing. So almost to a certain extent, we might need to put the mechanisms, the operational mechanisms in place now in terms of closing that loop now, actually getting the evidence, actually getting the understanding of where our status is, where the problems are, where the gaps are, before we can even begin to come up with a solution. Because like you said, we might think that there's a problem and find out that actually this rarely ever happens. I don't know. It's such a challenging thing. And I think what adds to the anxiety around all of this as well is we are a highly transient community for one. And 2/3 of our population are students or people who move in and out every year. We're growing in our society with people who don't know their neighbors. Coming off of, a decade of, if you see something, say something, call the cops around everything, instead of saying, hey, it's your neighbor, can you turn on your music, or what's going on, or are you okay, right? People aren't even encouraged to reach out to their neighbors or get to know their neighbors to say, yeah, I think they're having a party. I'll just give them a call and tell them to tone it down a little bit. So I think I don't think it's an either or. I do think that it's a yes and. Yes, we need better training. Yes, we should close the loop. Yes, we should look at the data. Yes, we should re-examine all the calls that we're sending law enforcement to, make sure that we expand our toolkit of responses, so it's not just this hammer response to every situation. But when we're dealing with this in front of us, the amount of money and resources and time and attention that is required to do even just a fraction of what we're talking about is just beyond our resources when we're dealing with tremendous staffing shortages already, whether or not you're dealing with mental health, whether or not you're dealing with law enforcement or homeless services. All of the departments are facing staffing shortages. So how do we, bridge all of those gaps? But I'm going to come back to whatever we do should be evidence-based. And we need to really thoughtfully think about how do we operationalize all of these aspects together, because otherwise we're talking up here and we're not able to put something in place. And I see PB has their hand raised again.
Phoebe?
Okay, thank you for that, Cynthia. But I really want to be a little more transparent when we talk about evidence-based. We have not spoke of what has been that we need to talk about, which is systemic racism that flows through every organization throughout our history and continues. And we need to be very honest about a lot of the ways in which our officers maybe not willingly interact is because of the history of systemic racism, something we don't talk about. When we talk about the executive order that was put in place, Executive Order 203 came in place because of what was happening in Black communities to Black people. And that's why we was charged to do reimagining public safety. So we should continue to remember that and in everything that we're doing. I try very hard because I work very closely with John Barber. We created meet the chief monthly meetings with the chief, inviting community once a month to come in, other activities. So I've seen this community work really hard at building relationships. But if we don't talk about systemic racism and how we continue some way, unbeknown to ourselves sometimes, working from that premise, we are going to continue to keep going in this loop that you talk about. That's just been coming through to me, and that we need to be really honest about why we want reimagining public safety, why the Black community really wants it. Thank you.
Thank you, Phoebe. This isn't about training. IPD claims that they do the best training for every police department in the history of police departments. It's not about training. A lot of it goes back to policy. before we went live, we were talking about the shooting of Sean Greenwood. And at the end of the day, if you put a black officer, any one of them at the time, in place of Brian Banks, we have a different conversation, right? The problem was the policy on trying to do the drug deal at that time, at that place, in that location, the way he did it. There was total disregard for safety, for black bodies, and the thirst to get 2 ounces of drugs off the street. Somebody lost their life. That's really what it comes down to. It doesn't matter who was on IPD then and who is on IPD now, because shortly after, there was another shooting, Keith Shumway, and the black community responded very different. It was tragic, but we understood what it was and why it was, and we didn't respond the same way. That officer is still here and is considered one of the better officers, probably the best officer in terms of community policing that we have now. But yet this person isn't used the way that they should be, right? It's crazy to me that we're this far out of reimagining, the whole giving you all something to look at, the documents, the recommendations. And there still isn't a committee of folks from IPD, community advocates, to look at policing policies that we have. Like, at what point in time do we really get down to it and we look at the policies? Because at the end of the day, an officer can do everything, somebody said it over here, the right way. But it's the wrong way. It's the absolute wrong way, but they follow policy. They follow procedure. Why is that? Why aren't we talking about that? Why aren't we getting to the root of this? If you have a car and your tire keeps going flat, and keep fixing it, at some point you got to figure out why is the tire going flat, right? We can keep having this conversation over and over again. We have to get to, and we have to talk about leadership of our institutions. If we're not going to talk about policy, if we're not going to talk about leadership, what are we doing here? What are we doing here? We've had some good discussion. There's a lot of things that came about, but this, it has to be rooted in ways that can make actual change, like meaningful change, real change. We can bring all the folks together in this community and do months and months of training. At the end of the day, if you don't have the right people, if you don't have the right policy, none of it matters. Because you're going to go right back to doing what you were taught. You're going to go right back to doing what the book says to do. We have to address all of that. And we keep talking about things that don't get to the heart of this, to make changes in RPD, in the way RPD interacts with the community, and the way the community interacts with the PD.
I think training is important. I think the people are the most important thing. How invested they are in the community, how much they understand the community.
Mm-hmm.
When you say policy, can you define more specifically what you mean by that word?
I'll give you an example. It was 2 summers ago, summertime, wasn't in Ithaca, so I want to be very fair to our PD. There was a family of black folks. They were in a parking lot at a grocery store. Something happened with the father. They had to pull him out the car, something with his license. During that process, that particular PD, their policy was that everybody has to get out of the car and get cuffed. They had 4-year-old kids, 6-year-old kids, 15-year-old kids laying on blacktop in the summertime. Officers did exactly what they were told to do by policy. That's policy, right? I can't imagine why an officer would have thought that was something they should do, but this is what policy says, right? So when you talk to folks from the PD, they'll tell you, this is what the protocol says. This is what we have to do. This is what's required. Many of them will say, I wish it wasn't. I wish I didn't have to do it this way, but this is what we're told. This is what we're trained to do. This is what the policy says. So if you have officers that get it and you start to go through policies that can be changed, then why not do that? Because in 10 years, if you have the same policy, we're right back to where we started from, right? And so if there's a response that you get a call and the response comes into the PD that there's X amount of people doing this, how many cars have to show up, right? So if the response is that 4 officers have to show up to X amount of people, then for us, it looks like you're coming to get us, right? So can the policy be that you come to the situation and make a decision from there, and then you call for backup, right? I don't know. Well, I'm not an officer, but there are plenty of those policies that can be changed. I agree, training is important, but how many times do we just check the box? Here's a list of trainings that we have to do every year. We have to do equity and inclusion and this, that, and the other, and we check and we check and we check. And then if we're talking about officers knowing the community, living in the community, how many city employees can afford to live in the city? It's not an expectation, fair expectation, IPD can live in the city. It's how often you interact with the folks that live in the city outside of uniform.
Right.
So why don't we have a policy that says if an officer's work week is 40 hours a week, that 3 hours a week have to be spent at some sort of agency in the community, some sort of nonprofit doing volunteer work, you're getting paid for it. It's not technically volunteer work, but you're interacting with the community, right? You're getting to know the community differently. Like, to me, there's just real simple ways that we can go about doing this that affect permanent change. And you know, we still keep having the same conversations.
Yeah, I, as I recall, there was somebody in the Reimagining task force who made that exact recommendation.
That would be me.
I know that. And that's a damn good recommendation, and that's, I think, one of the things that we'll probably recommend as well. Yeah, I have to say, to your point about everybody getting out of the car and handcuffed on the blacktop, in this community, I personally saw a hillbilly family trying to get home for Christmas, car full of kids. All the tags on their car were out of date. They were pulled over by a black city officer named Mo. And Mo got them in the house to get warm. Didn't let them go anywhere. Let them call the grandparents to come get them and take them to Christmas dinner. That's the policy in this town, at least in Mo's car it was.
In Mo's car, I've been in 20-degree weather standing outside of my car cuffed. At the time, my girlfriend and her 2 infant kids standing outside the car for 30 minutes. I've been there. I've seen our policies firsthand. I got stories for days. I don't share them all. And others have stories. We heard from over 130, 200 people who shared their stories,
Yeah.
right? So the stories are there. So there are policies. There are things that we do for people that look different than that hillbilly family.
Then we got to deal with that.
I love having your meeting because it gets real quick. I don't know if we have policies. I honestly don't. George will attest, what, 5, 6 years ago, we as a council set as a priority that we wanted our department to be accredited. And part of accreditation is to have a complete set of policies that meet best practices. I don't know if we have policies because I have seen time and time again where complaints have come forward about incidents and they were investigated and basically they got dismissed because you could say the behavior was consistent with established policy, but when you actually looked into it, we had no policy. We had no policy, for example, about what off-duty police officers can do when they approach an individual. How do they call out? Can they even be engaged when they're off-duty and called in? There was no set of policies for that. There's no set of policies when, an off-duty officer is engaged in a bicycle accident.
There are,
But actually, in those cases, we created policies after the event. You know which I'm talking about. And in my experience, in this time I've been on council, again and again and again and again, something happened. no corrective action because there was no policy for them to be held to. So I do believe, I agree with you 100%. We need to look at those policies. I think that our policies are probably not complete, which is why we have for every year for 5 years, again, put money, we created the deputy chief of professional standards for the purpose of creating a complete set of policies, and we don't have it yet.
So that goes back to leadership. Like at the end of the day, if this is something that y'all asked for 5, 6 years ago, and you still don't have it, we've had several different chiefs take the title at the PD. If you've been asking for policy, if you want accreditation for the PD, and the chiefs haven't delivered yet, how come they were chiefs? How come they stayed in that role? Like at the end of the day, there's a
Okay,
certain set of expectations that every one of us city employees have. And you get your check, you keep your job when you meet expectations. If you can't meet expectations, then who's holding them accountable? And this is why during reimagining, I said over and over and over again, there needs to be somebody in charge of the PD outside of the chief. Not
Yes.
common council, not the mayor. There needs to be somebody ensuring this would happen. Because 5, 6 years ago, if you had somebody whose job was to ensure these type of things got done, then maybe it would be done. Right now, who is managing the chief? And not just this chief, but any chief we've had before them, who is managing them? It's not
Thank
the
you.
mayor, it's not the chief of staff. There's, how many departments do we have in the city? Y'all would know better than I do. I know one great one. Several. We have several departments within the city. And you're asking the mayor or the chief of staff to ensure that these things get done at the PD. That's part of the problem. Not this mayor, not the last mayor, the mayor before, any mayor, right? I'm not putting the blame on anybody. I'm not calling our current chief out 5, 6 years ago. That'd be John Barber, right? And we don't have it yet. That's a problem. There's no accountability. So if you all want something and you don't get accountability, imagine what it's like for the people in the streets who demand accountability. If you can't get it, we definitely aren't getting it.
One big part of this problem
Thank you.
is the fact that that deputy chief you're talking about is an empty position. There's one deputy chief, there's supposed to be 3.
But for how long though?
It's been a
5,
long
6
time.
years?
No, it's valid.
No, it is not. There's an acting chief who had that position of, that was Dennis Nair's position before that. And there's Vince. And there's 2 empty positions. There's currently 50 police officers active. There's 15 empty positions. So the importance of community policing and follow-up and getting to know people is limited by the fact that sometimes there's 2 or 3 officers working in shift.
George, I agree with you. I agree with you 100% now. But this issue didn't happen last year. This issue has been here. I've been here since 91. It's been an issue since 91. And if you talk to folks that have been here since the 60s, they'll say the same thing. Right? This is not a brand new issue. This is not a brand new issue. So when we had 80 police officers, when we had 90 police officers, things weren't better then for us. It was the same. So like where we are now is where we are, right? But these issues didn't start last year. This isn't an issue because of staff shortages. Some of the other issues that this community is dealing with is an issue because of staff shortages. But this particular issue has been happening for years. And when we had enough officers to address it, we didn't. When you asked for accreditation 5, 6 years ago, we certainly had enough officers then, right? We even had community police officers back then. We had people riding bikes back then. So we were at a place where we could have addressed this issue and we didn't. So now here we are. So for me, all I'm saying is whatever is going on at IPD, whatever staffing issues, whatever's going on in that house, that's not my problem. That's not the problem for the community I represent, because when they had enough, they didn't address this issue. And this is part of the problem. The whole reason we're here, and Feedy keeps bringing it up, is this is a reaction to George Floyd. People are upset because for years this has been happening to us and it hasn't been taken care of. The PD hasn't held themselves accountable. And this is how we got where we are. Because they didn't hold themselves accountable. They didn't say we have bad police officers, you gotta go. You're a bad officer, you gotta go. You did this, you gotta go. Every other place of employment, we get rid of folks. In this PD, we weren't getting rid of people. And everybody in this room that's been here for some time knows that to be a fact. We've gotten rid of a few, and some have kept rising up and rising up. So we are here now. The fact that we're short-staffed, that's really not my problem. Because I've been dealing with this for a long time. So we gotta wait, what, 4 or 5 years until we have a robust police force again? Like, you keep putting it on us.
I'm not putting it on you.
The idea that things can't get done because we're short-staffed and we have to wait, that's on us. Because we deal with those repercussions. We deal with those outcomes. That's who ends up dealing with it, is the same people that this whole thing was started for. We hold that weight. We carry that burden, right? Not the PD, they don't carry it. We carry it because it affects us. That's the problem.
I'm not following you. I gotta be straight. If there's 2 emergency room doctors in the emergency room.
How many people they got on administration, George?
Pardon me?
How many officers sit on administration? Right, you have officers that are on road patrol, and then you have officers that do administration, right? The officers who are on road patrol have to deal with the brunt of what you're talking about. The officers that are in administration should have been administrating, right? They should have been doing these things. This is why they're in administration. So I understand what it looks like on the street and on the road, and I've gone to the meetings. We had the meetings on the west side, we've had the meetings on the north side, we have meetings all over this community about the increase of violence and trying to figure out how to address all those things. And IPD is in a very bad way because they're short-staffed. I got the front line, I get that. But behind the scenes, these are things that from the chief down, they should have been working on these things. Like that's a reality.
I don't disagree with that.
That's what I'm saying. I understand that if you have 3 officers on a shift out in the streets, first of all, that's insane to me. This city is way too big. There's way too much happening to have 3 officers. I don't even think 4 or 5 officers is enough to be out on the street, especially with the uptick in crime and the things that a lot of good folks are dealing with this in the community, dealing with in this community. So it's not to me about the frontline officers in that way. It's about administration.
You're talking about leadership.
Exactly. And it goes back over time. It didn't start last year, 2 years ago.
I'm trying to understand.
I'll help you.
Can I ask a question first? Then you can.
Go ahead.
We've been talking about things that we used to have, some of the issues that Post Hall instituted, follow-up, et cetera, community police officers. Are you saying things were just as bad then as they are now?
In some ways, things were worse then. A community police officer is not the fix. A community police officer is 1 or 2 officers that deal with certain situations. Most of the times in PDs, the community police officer is looked at like the social work officer. They're not regarded as doing real policing. They're actually doing real policing. They're doing the most important policing. But when you put so much money in the SWAT and all of those, this is Ithaca. When you put so much money into all those other things, and you have a group of folks, chief after chief after chief, who grew up through SWAT, what do you think the PD looks like to them, right? What lens are they looking at policing through? It's not their fault. This is what they were trained in a PD that we have a robust SWAT. This is Ithaca again. So if your leadership represents one group of the PD and you keep pressing that way, this is what that's gonna look like. It's just what it's gonna look like.
So what I would argue is every officer should be a community police officer.
Absolutely. It shouldn't be community police. That's the thing, George. It shouldn't be community police officer. It should be community policing. Like community should be at the forefront of policing.
I got no,
And that's what it's supposed to be. Every officer should be doing that.
that's essential, in my opinion, that's a central aspect of this reimagining.
Yes. Bill, let's even go ahead.
Yeah, Pete, chew me up.
No, I'm not gonna chew you up. I'm just saying we gotta listen and hear Travis. Everything that you've said has been on point. Or that these problems didn't happen just this year. And yes, it has been affecting Black communities throughout the years. This new talking about this new wave in crime, and what I'm saying is I totally agree with Travis that we have to really look at administration and how they are responding. If we don't have policy, we should know why. Cynthia said they asked for it 5 years ago. Why we don't know the policies. I spoke with the officer who worked in this community, and when we spoke, she talked, well, I don't want to say, we talked about policy and laws. If they're not changed, it will continue to do the same thing and get the same results. So I'm real happy that you're here, Travis, because I hear you clearly. And thank you again.
Heather,
I also agree that my experience with working with the community police officers, that there were many ways that they were marginalized, I think, within, and I agree, and I heard people, like, we were doing the social work policing, and I think, what we don't want to, what I would recommend not replicating is that same model with an unarmed response, that there's sort of status quo, and then there's this other, and that, we're instead of addressing the underlying systemic issues, the systemic racism, and I agree. I also, this is not, I feel like I don't have quite all the words for this, but I'm thinking back to, I was speaking with someone about a month and a half ago who participated in the task force, and I'm thinking about what she said, because I don't want to, I'm paraphrasing what she said here, but feeling that she as a community member, was asked to be vulnerable, right? And to share her vulnerability and share her pain and share her experiences. And feeling like that had been discounted in the process. And then that there's a lot of white people sitting around the table talking about then what's happening. And I guess the thing I'm saying is in the desire to be evidence-based and the desire to have data, that we're also not requiring communities to continually make themselves vulnerable to prove or make the case for change. I think that's what I'm trying to say, if that makes sense.
Absolutely.
can you make that think about more than data?
Yeah, and I think gosh, there's something you said, Travis, that really made me think about this earlier, and now I'm trying to track back what it was you said that sort of triggered this thought for me and made me think of this person I was talking about. But I think we have to, it goes back to, I think what is being said, that underlying that there's some underlying assumptions. There's some underlying findings that I think in realities that were reflected in the task force report and reflected from the voices of the community, and keeping the process centered in that reality
Let's,
You know, there's this woman, Sharana Burke. She was the Black woman who founded the Me Too movement, way before it became like Twitterized in, you know, Hollywood. And she came to speak at Cornell in the before times. And she was really speaking to service providers at that point, people like me, and talking about how when we think about systems, you know, if we're thinking about how do we make the systems the safest and most accessible for the people who are most vulnerable to those systems, like that is how we build systems and build change. And I've been thinking about that. I feel like those words have rattled around in my head, you know, for the last few years. So thinking about like, how do we create systems that are going to be the safest for the most vulnerable people, the most marginalized, the most at risk, and then sort of centering our decisions on that, because other people who aren't as vulnerable and aren't at risk will still be able to access them.
Right.
You know, if that's what we're doing.
I get it.
And so, yeah, I feel like I'm not at my mark to articulate at this point of the night right now. I also didn't get enough sleep last night. But I just felt yeah, I mean, I think the need to really make sure that we're still centering that, and that we also didn't ask the community to do, or parts of our community to do labor that, you know, that were, and I know I'm jumping into the middle of a conversation here. I want to really recognize that. But I've really been reflecting on that since the conversation I had with that person a couple of months ago. That made me think about it tonight.
I'm reluctant to follow on that. I feel like that was a very valuable point, and mine is going to be like hyper narrow, but it's just the way that my brain works. Like going back again to the community policing rather than community police officer thing, and then trying to translate that through the perspective of being in the position where we can mandate policy change, right? I draw the analogy to, you know, I work at Cornell, it's my day job, right? I draw the analogy to like faculty incentives for various things to try to get tenure, right? I mean, as a matter of policy, right? Can we look into, for example, are we able to require as a condition of promotion that someone satisfactorily complete a rotation in, you know, a more community, frontline community policing role that like, but as we're looking for, you know, succession planning in administration and leadership positions, that like we're sending a message to the workforce, in this case being PD, right, that these are things that we really value, and this is not a box checking measure. This is a thing that, you know, if you're looking to advance in our organization, here's a way that you can, you know, demonstrate that additional value to the organization. I'm not at all suggesting that like this one off the cuff idea is a solution to anything, but I guess I'm just sharing, like, this is how I'm trying to like take some of the extremely like salient and big concepts that we're grappling with right now and trying to get like the germ of a direct intervention into like what can we do as next steps.
Thank you. Cynthia, I'll just remind us all, it's getting late. And you know, but please.
I mean, I appreciate that sentiment, but I also know that people need to come in with a particular mindset in order to embody that position and do it well and come away from it. But I understand where you're coming from in that. Going back to my question about operationalizing things. And I hear you about people having been very vulnerable and sharing their story and submitting that to this work. And it's traumatic, right? I mean, I feel it in you, I feel it in all of us as we talk through these things. And when I think about that feedback loop, what's been really hard is I think that there has been a siloing of conversations that, yes, the conversations were important and they informed individuals who then took those conversations forward. And then conversations about this group brought this forward, but you didn't have groups hearing from each other, talking with each other, and actually having to to be present in that. And when we think about healing, for example, you know, if I've been subject to what I feel to be inappropriate action, and I can talk to a whole bunch of people who stand behind me all the time, all day long, about how this was inappropriate, but I don't get to heal until I actually speak to that person and say, you know, this happened. It was, you know, devastating to me. And to have that person at the very least say, I hear you, I take ownership for that. And hopefully have a conversation to say, we're not going to have that happen again, or do something to change that. And it has been groups talking, and then you end up with us sitting here afterwards. And so I don't know. It feels like part of that conversation, and as much as I know it's traumatic and we don't want to, you know, re-traumatize individuals, but how can we also build in that feedback loop? I was having a conversation with a colleague earlier, and to your point about, we have individuals who we know are the problem, and they get promoted and promoted and promoted. And then you find out, well, nobody ever issued a complaint, or the complaint didn't get registered. And then when they come up for promotion, they sail all the way through, and the rest of the community is sitting going, wait a minute, how did this person get in that position? And part of it is the people who were injured didn't either have the ways, means, or confidence or knowledge of how to actually bring that feedback back, so that we don't end up replicating the same thing over and over and over again, thinking that we're doing a great job, right? And so we can, if we don't close that loop, we can look at all the policies, we can look at the training, we can put people into positions of community policing and think that we've done it, but we're again just going off of what we think and not getting a chance to ground truth it and say, oh, that person you had doing that caused a lot of trauma to these people, but these people didn't know how, or didn't feel confident, or just chose to check out of the entire situation at all. And then what we thought was working was actually flawed, or in some ways causing more trauma, because we just kept at it again and again. So again, like, how do we operationalize it? How do we bring this back and know that we're actually making the kinds of successes that we're aiming to achieve?
I've got to push back just a little bit. You said something when Rob was talking about the you know, community policing and having them, you have to have the mindset when you come in. You actually don't. What you have to have is people who are determined within the PD to ensure that everybody develops that mindset. Brandon Goldsberry, who I hold as a high standard for community policing, he didn't come in with that mindset. The person that onboarded him, his trainer, did that for him. He has done that for others. That officer who trained him, who no longer is with IPD, has trained countless officers, brought them all to GF, brought them and helped them build relationships with certain people in the community. That wasn't something they came in with necessarily, but it was part of the culture that this officer was trying to develop. So that's one. Two, when we were asking people to share their stories, this wasn't for the PD to have an exchange or for people to heal. That's part of the recommendations. That's something that's actually happening now, right? This was for us to say to folks who are supposed to be making a shift, making a change, coming up with something for us. This was an opportunity for us to download. I can promise you that 90% of those folks wouldn't have had that conversation with IPD at that moment. Why would they? They're already expressing that they had these negative interactions, and then to sit in a room and do that then? No. Those folks need some time to heal. And that was part of this whole community healing process. the IPD healing process, and then to bring them together. Like, it was a very well laid out plan to do exactly what you were asking to be done. That wasn't IPD's time, that was our time to share. It was our time to say, this is what we've been through, this is what we want. And then folks said, here's these recommendations based on what these people have said to us, right? So but it's baked in the cake. It is part of the recommendations to do this community healing,
Thank you.
which has been stalled out time after time after time. And that's a shame, because that's something that could have been and should have been happening this whole time. That was like low hanging fruit that we could have been doing this whole time. The other thing about folks getting promoted, this is very difficult because I don't want to put people's names out there. That's not what I'm here to do tonight. But it's not just that the community is aware of these things. And part of this goes back to policy. We have a lame community police board, and it's been lame forever because there's no teeth. People come, they make these complaints, there could be findings, and then that's it, there's a finding. And nothing tangible happens after that. And so people stop making complaints. People stop going to the police board because nothing ever happens. It's policy. That's policy, policy, policy. You can change that policy so people can come and make these complaints. But some folks that have been promoted over the last 10 years, there are folks sitting in this room that are very aware of the things they've done. It's been it's been in newspapers, it's been out there in the community. People have been founded for things, and it's still not, they didn't just lose their job, they have rose up in the ranks of the PD. So there's stuff that exists that we all know about, we're all aware of. We've talked about some of those things. I'm not here to put anybody on blast tonight. We've had those conversations. We know we can go pull up newspaper articles, right? So we can't say that people have rose through because nobody reports. Because people have been founded for things and it still rose up through this police department. And that's a shame. There's policy, policy, policy.
I just have to thank you again, but I just have to say, when you ask for the people in the reimagining public safety findings and the what they're asking us to do, that was their way of they used that time to ask I'm getting it all mixed up now. But what we're working on, the Reimagining Public Safety manual that they gave us, what their suggestions and recommendations, that came because people came out and shared. And that's where these recommendations came from. Also, you cannot get people to sit in a room and heal if one party is not accepting their responsibility. And I talk about this all the time. I'm a recovering addict. I've been in recovery for 23 years. And the only way that I could ever begin to work on my problem of addiction is when I found acceptance and was able to acknowledge it. And it's the same. And the way things started out with the IPD against RPS, no one, they never took responsibility of, no, that all of those that was happening to Black people didn't happen in this community per se, but there are things that has happened in this community that, yes, we acknowledge this is not right. Something is wrong and something is broken in policing. And we want to make sure that our community does not have those issues. And the first thing to say is we have the best officers. But anyway, that's another topic, but I don't know. I'm not as eloquent tonight as I could be, but I'm trying to say, what I'm saying is when we got the recommendations from RPS, that's where those people who came out, that's where those recommendations came from.
I'm going to disagree with you a little bit, Phoebe. The the interviews that got the whole reimagining process started, I consider very real and very important. I was part of the task force, as was Travis. And I can't honestly say that all the recommendations that came from the Reimagining Task Force were rooted in those very real problems in our community that people took a chance and told us about. So I don't think it was that simple, and I think the recommendations, some of them are flawed. Which is not to say that I think IPD gets a free pass and shouldn't face basically what the stories that Travis is sharing with us tonight. The problem I'm dealing with right now is one of the main recommendations that we're tasked with is what to do with this unarmed wing of city government. Now, I've heard tonight that it's more about how professionals respond to a situation than whether or not they're a police officer or an unarmed person. And I'm also hearing that please don't make the same mistake of just making these unarmed people, unarmed community police officers and be siloed in the same way they have been in the past. So what purpose should these people have? What jobs should they do that will really benefit the community?
One thing that I would say, what it does is if you have people who are from your community, are familiar with your community, it makes you feel safe in the situations. So that's what I'm seeing unarmed responders as, another face that they can identify with.
To me, if I was to answer that question, it's a co-response model. I'm not looking for these folks to do police work. I think that these folks should be doing co-response work, whether it's domestic violence, whether it's mental health issues. We can say, here's the 5, 10, 15, 20, whatever. Here's the amount. These are the things that these folks are going to co-respond to. This is what we would like them to co-respond to. They don't need to co-respond to everything, but here's the 5 big ones. This is what we're looking for them to co-respond to. They don't have to do like police type work. Like, why should they? They should be folks that are trained to do co-response work. I mean, that to me gets us to a place where we have better outcomes when everything is said and done, both for the people, the victim, the person who could be the perpetrator, so to speak, the person that's dealing with issues, even the IPD. Everybody wins with a co-response model. We talk about how many officers we have right now on a beat. You got 3 officers this evening. You have somebody up and down West 3rd Street that has mental health issues, that is in one of those moments. And an officer is dealing with them for 45, 50 minutes. I watched the videotape of a friend of mine who suffers from mental health issues. He was on Facebook Live, and 3 different stores for about 2 hours. 3 different officers were dealing with him the whole time. He wasn't going to hurt anybody. If there was a co-response model, a Travis Brooks, a Rob, a George could have went and worked with him to help him figure out what he needed, what was going on with him. and the officers could have went back and did police work, right? When we talk about co-response type models, it takes a half an hour for an officer to respond to a call, decide a person is right for leave, make the phone call and pass them off. And then you have better outcomes for that person. If you arrest that person, you're gonna spend 2, 3, 4 hours. You know how many officers we have? Putting people in leave? 2, just 2. We've been running for a year and some change. We have 2 officers that utilize it. Why? Leadership down, right? It's actually saves officers time. So if there's 2 officers on, and I can get George in the program and go do some other police work, then cool, I'm out. A domestic violence, you have an officer say, Heather, everything's cool for your people, it's safe, and they take over, and then you just have, hopefully, such a different outcome for everybody that's involved in that situation. Like, to me, during the reimagining process, we went back and forth in that particular group, and like some of the ideas, like for me, this is what we have, and we have a model that's operating in Rochester that's working well. We have folks here that were involved in that before that can help with that. Like we can do that. We can offer that to this community and put people in much better situations when they're in need, and let officers do what they signed up to do. We do have some good officers, and some of them are phenomenal. But they didn't sign up to do mental health work, right? Like, let people who do that, and let those officers get back to the idea of policing. If I'm tied up for an hour and a half on a mental health call, but I have this issue over here, we have a domestic over here, we have this, and somebody's waiting for an hour and a half, it's not the officer's fault, right? We're short-staffed, but this is a way for them to get back to doing, and it's one of the things they asked for. Like, we talk about, like, how did we marry the situation with the PD? They gave a bunch of recommendations to Common Council, the PBA. And a co-response model was part of that. So if they said, this is what we want, this is what we're willing to do, and we're saying, this is something that we think could work, this is something that we want to do, then what's the problem? We already have one, well, let's marry it and make it happen.
Part of the problem, and you know this as a member of the county legislature, is the county has a health department, including mental health. And it's the county's responsibility to manage mental health in the county, including the city. So the city certainly has dipped its toe into mental health. And we can certainly be a bridge between people in crisis getting to the right services, but the city can't afford, nor is it their duty to provide mental health services.
Let me ask this. I don't think the idea was to provide 5 social workers. That's what the county does. I think the idea is to provide 5 co-responders. If you look at the Rochester model, they're not 5 licensed social workers. Some of them are people with lived experiences. We went to the National Harm Reduction Conference a few months ago. And when everybody dipped out in COVID in New York City, the people that took care of people that were struggling were people who had lived experiences, right? A person with lived experience sometimes is better than somebody with a degree in dealing with those situations. So George, I'm not suggesting that the county give up mental health services. And in those situations, it's a co-response in a moment of crisis. Rob is the social worker that works for the county. I'm the co-responder. I'm gonna use you, Cynthia, because you're right across from me. And what I do when I'm working with Cynthia in that moment, I try to bridge Cynthia with Rob for long term, right? This is a moment of crisis. So I'm not suggesting that the city take over mental health. I'm saying in this moment with a co-response, you work with somebody and then you can assess, maybe they need to go over here. Maybe they need to go over here.
Maybe so
Can I just give it?
No,
I'm
no,
sorry,
you go ahead. I just want to get a list. that's all.
Phoebe has had her hand up and I'm totally stepping in.
Go ahead,
Okay.
Phoebe.
And this is, I'm glad you brought up the part about lived experience, because I really have been sharing when I was working with mutual aid. No. When I was working with multicultural resource centers, we had created a response team, right? For going out when things came up. What I wanted to say is there are community centers, there are places in our community that already keep our community safe. GIAC, Southside, the Creative Hub, Multicultural Resource Center. There are other, Ithaca, the Village of Ithaca. We have organizations that we can pull upon that are community members that have lived experience that people are comfortable with. So that's why for me, a long time, what was pushing me away is keep hearing about, we have to make sure that they are social workers, therapists, psychiatrists, and just not talking about people who are already doing the work, grassroots organizations in our community that's doing this work, keeping our community safe. People already use them. So I think there's a way that we can all work together, because I think the important piece that I think I keep remembering is I want us to all work together, because that's the only way it's going to work. IPD, community activists, everybody. Thank you.
Thanks, Phoebe.
Yeah, I think I'm also supportive of the co-response model. I think that a lot of time can be spent trying to find like the perfect flow chart of which calls where, and there's still going to be so much gray on that flow chart about who responds where. And I think a lot of time and energy is going to go into that instead of the work, potentially. I think the co-response model has real value. I think it's also being realistic based on the amount of staff that my understanding is that's been proposed. Like what kind of what role, what roles and expectations are appropriate for that? Because like they're not going to be taking over mental health services, right? Like that would need to replicate this whole other large system. And I think of being that focused bridge. And I was thinking about a situation we had not that long ago at our shelter. We operate confidential domestic violence shelter, where we had a very significant crisis there, and we ended up with IPD there. It was 3 to 4 hours. It crossed over 2 shifts, and I will say they were fantastic and caring and responsive and non-escalating in the response. But we really didn't need law enforcement there. We needed something to help bridge for this client in a different way to these other systems, and to have established relationships with the crisis mental health team and with the hospital and with, and be able to negotiate that. And I also, and I say this as a social worker, I don't think social workers are necessarily, there are some social workers who decided to do social work in a particular kind of community focused way, but I don't think that's what makes them good for the job is the degree. I think it's how they're doing the work.
Right.
And I do think that that's what this role could really be valued. And because I get really twitchy when we start to also put a mental health model on community problems. And again, there are some social workers who are operating in a really macro community focused solution way, but when we start to focus on this mental health model, when we're talking about other structural inequities in the community, and even when we're talking about domestic violence also, I get really twitchy. And so I think that not trying to replicate a mental health model is actually a strength of this, not a deficit. But we also, can I say, you're going to have to pay people well enough to do this work. I just want to say that in this, because it is really hard right now to get people to do crisis work on this side of the pandemic. I will tell you that.
Absolutely.
It is,
Get people to pick up a shovel without being paid.
it is, I mean, the labor market is real right now, and getting people, this is difficult work we would be asking people to do. I think it's really good, important work. It's exciting to think about these other models, but I think cost savings is not, versus paying what, social workers aren't paid that well in this town either.
So I think we're on to something that we all agree on. And I think I would add, which I think Phoebe's alluding to, is that it can't hurt if a lot of these people are local with lived experience.
Absolutely. Absolutely.
And I'll just add with something that's obvious. These people aren't necessarily gonna be needed between the hours of 9 AM and 5 PM. So, and we're gonna start with 3 or 4. And so we're gonna have to figure out how we're gonna deploy them.
Just on that note, I was curious. Or. I'll attempt to speak with Cynthia too, because I know we try to think about problems the same way, but I'm curious, as a next step for this group. You know, would it be useful to have a draft concrete proposal what this would look like? I think that would be helpful.
That's what we're supposed to do.
But as the committee members know, right, I've circulated a draft of a proposed idea that I don't necessarily think is the final answer to this question, but like, again, the way I think about operationalizing things, I think it would be productive. I would just humbly suggest, I think it would be productive for us to like have a diagram, so to speak, to then start picking away at, to say like, how would we answer this question of like, what are they going to do? How do they help triage? And where is the actual realization of the concepts that we're talking about?
I think that's bullseye. Are we all gonna try to do that, or just some of us gonna try to do that, or?
I think there's a framework for something already.
I've shared
Yeah,
two documents, which we can talk about, yeah.
Obviously, we have to talk about, if we're talking about the same document, we have to get buy-in from the departments
Yeah, of
who's
course.
gonna provide the space. And I don't think we're looking at an exact copy of the Rochester model, because they've got
Right.
50 or 60 people.
No,
And
they have 5.
they have a lot of people. But
No, the co-response is 5 folks.
5.
it's the people I have been emailing with sent they got 4 different departments. And they deal with victims of murder, they've got a lot of people.
Now, I'm saying the co-response piece, they may have a bigger program, but the co-response piece is 5.
Okay,
Yeah,
all right,
yeah, I think they have a much bigger program that deals with other issues,
yeah,
but the co-response is 5.
okay, all right.
They also, I'm looking at Travis here, they house it in their recreation.
Correct.
And so it's not part of their police department, they have it now.
And that's an important separation.
Right, I mean, we have the community outreach workers, we have lead, if you had a co-response model. My suggestion would be to either create a department or use an existing department, especially one that, I won't even say it, but use an existing department and put them together, because you have this natural flow of things. You have folks who are always out and about, right? The community outreach workers. You have people who are going to respond in crisis. And then you have a program that says, okay, we work with folks that are struggling in these ways. And you kind of have this thing flowing a little more. And then you have all this different conversation about folks, because I can guarantee you 25% of them are going to pop up in each one of these areas, right? And so then you can just like really build out this program that hits in very different ways across the board for a lot of different folks in the community. And the outreach workers, for the most part, have a really good relationship with the PD. We have showed what a relationship can look like with lead and the officers that participate. And what that can and should, I mean, that's what, to me, what reimagining looks like, what's happening with those folks. So like some of the stuff already exists and in the fold in another program, to me would make a lot of sense, which I have to get you or somebody from you, yeah.
You know, I'm thinking about, yeah, I've been really involved, or I've been coming alongside of this group that we're calling the Enhanced Outreach Group, which is folks who are working with folks who are living rough and living in the encampments. And I think Cynthia and George, you've come to a couple of those meetings when we've had larger community meetings to talk with that group. And I think about, you know, the role of the outreach workers and how that, I feel like that was a catalyst for other things happening then. Right, that when we had the outreach, it both reduced the friction of trying to have a more appropriate place to refer folks to who are struggling with homelessness and mental health and what had been considered nuisance calls or really human calls, but then also created this opportunity for new things to happen around that. And I think I would hope the same thing here is that it would have a structural value of supporting a different kind of response, but then also both identify where more needed to happen and create opportunities then, whether it's in collaboration with other organizations, whether it's raising those questions about where are the other places where things need to change, whether it's identifying the places in the system where things aren't going as we want them to in our community. But again, I think we have to have clear expectations about what their role is, right? And what are the outcomes that, how is the program being designed to meet those stated outcomes, whatever those stated outcomes are.
Can we leave it there tonight? You want to say one more thing?
Just one very small request. I just was wondering if Travis, if it wouldn't be too much of an imposition. I think I would love to know in an email, maybe, just as we think about the policy discussion we talked about earlier, any thoughts you had about how to get more folks to like opt into, you know, lead or how we can sort of provide more robust support for that. But I'm with George, we don't have that discussion tonight, but just we appreciate your thoughts. Thank you.
We can continue this discussion. This has been powerful, in my opinion. This has been progress. And again, I'm surprised that things went as well as it did. I want to thank Michael, Heather, Travis. I want to thank Melody. You guys are welcome to come back anytime you want. I mean, I asked you to come back. And we will next month. Our normal time to meet is kind of messed up because the EDC's changing their time because of Christmas, and so we don't really have a spot yet, but we'll work on that. So thank you. Any objection to?
I will move to adjourn.
Okay. Second. Say so. Oh, Phoebe.
I just want to thank everybody. This was awesome. But I raise my hand to adjourn.
Thank you. And Doc, I wish you'd shut up. But thanks for joining us, Doc.
Thank you.
Thanks, everybody. Excellent meeting.
Good night, everyone.
Thanks.
Thanks.